17 silent signs of prediabetes you should never ignore. Did you know that more than 1 in 3 adults have prediabetes and 90% of them don't even know it? What if I told you there are 17 silent signs of prediabetes that you should never ignore? Imagine finding out you have prediabetes too late, when it has already progressed to type 2 diabetes. Could you be missing any of these warning signs right now without realizing it? Want to find out what these 17 signs are that could literally save your life? Then, don't miss a second of this video, because in the next few minutes, I'm going to reveal each of these signs and what they mean, so you can take action before it's too late. Are you ready to protect your health and well-being? Watch until the end, and also discover 10 powerful tips to reverse prediabetes once and for all. Your body and your future health will thank you for watching this video today. Important. We have listed all the references used to create this video in the description for you to access whenever you want. Let's get started. What causes prediabetes? Prediabetes is caused by a combination of factors, including genetics, a sedentary lifestyle, poor diet, and being overweight. When you consume foods high in carbohydrates, your body converts them into glucose to use as energy. The pancreas produces insulin, a hormone that helps transport glucose to the body's cells. However, when you have prediabetes, your body's cells become resistant to the action of insulin, causing blood sugar levels to rise. Additionally, the pancreas may not produce enough insulin to keep blood sugar levels stable. Factors such as a family history of diabetes, older age, obesity, and lack of physical activity can increase the risk of developing prediabetes. Understanding the causes of prediabetes is crucial for taking preventive measures and making lifestyle changes. Is it possible to reverse prediabetes? Yes, it is possible to reverse prediabetes by making lifestyle changes, such as adopting a healthy diet, exercising regularly, and losing weight. These changes can help improve insulin sensitivity and reduce blood sugar levels. A diet rich in fiber, fruits, vegetables, and whole grains, and low in added sugars and saturated fats, can be beneficial. Regular physical activity, such as walking, swimming, or cycling, can help improve insulin sensitivity and control blood sugar levels. Losing weight, if necessary, can also be crucial in reversing prediabetes. In some cases, medications may also be prescribed to help manage the condition. It is important to work closely with a healthcare professional to develop an individualized treatment plan and monitor progress over time. What are the consequences? If you don't treat it or make changes, if prediabetes is not treated or lifestyle changes are not made, the condition can progress to type 2 diabetes, a serious chronic disease that can lead to a range of health complications. Type 2 diabetes can increase the risk of heart disease, stroke, nerve damage, neuropathy, kidney problems, eye problems, and even amputations. Additionally, prediabetes is also associated with a higher risk of high blood pressure, high cholesterol, and metabolic syndrome, a condition that increases the risk of heart disease and strokes. Ignoring prediabetes or failing to make necessary lifestyle changes can have serious and long-lasting health consequences. Therefore, it is crucial to take a prediabetes diagnosis seriously and work closely with a healthcare professional to manage the condition and prevent complications. What tests should I take to identify prediabetes? There are 3 main tests used to diagnose prediabetes: the fasting blood glucose test, the oral glucose tolerance test, OGTT, and the hemoglobin A1C test. The fasting blood glucose test measures the blood sugar level after an 8 to 12 hour fast. A glucose level between 100 and 125 mg/dL is considered prediabetes. The OGTT measures the body's response to glucose after consuming a sugary drink. A glucose level between 140 and 199 mg/dL 2 hours after drinking the beverage is considered prediabetes. The A1C test measures the average blood sugar level over the past 2 to 3 months. A result between 5.7% and 6.4% is considered prediabetes. Your doctor may recommend one or more of these tests based on your risk factors and medical history. It is important to undergo regular screening tests for prediabetes, especially if you have risk factors such as older age, a family history of diabetes, being overweight or obese, and a sedentary lifestyle. 17 silent signs of prediabetes you should never ignore. Sign number 1. Blurred vision. Blurred vision is a common sign of prediabetes that many people may not initially associate with the condition. When blood sugar levels are elevated, this can affect the ability of the lenses in your eyes to change focus, resulting in blurry or hazy vision. This change in vision can occur especially after meals when blood sugar levels tend to rise. If you notice changes in the quality of your vision, such as difficulty focusing or seeing clearly, it's important to schedule an appointment with an ophthalmologist for a complete evaluation. Additionally, inform your doctor about these symptoms, as they may indicate the need for further testing to check for prediabetes. Taking care of eye health and being alert to changes in vision can help identify prediabetes early and allow for proper treatment. Sign number 2. Excessive hunger. Excessive hunger, also known as polyphagia, is another sign of prediabetes that can go unnoticed. When the body's cells become resistant to insulin, glucose from food cannot efficiently enter these cells to provide energy. As a result, the body may feel a constant sense of hunger, even after eating regular meals. If you find yourself always hungry, even after eating adequately, this could be a sign that your blood sugar levels are elevated. It's important to pay attention to these signs and discuss your concerns with a healthcare professional. Keeping a food diary and recording your symptoms can help identify patterns and provide valuable information to your doctor. Managing excessive hunger through a balanced diet rich in fiber and protein and eating regular meals throughout the day can also help manage this symptom. Sign number 3. Irritability. Irritability is a common symptom of many health conditions, including prediabetes. When blood sugar levels are unstable, this can affect the chemical balance in the brain and lead to mood changes, including irritability and impatience. If you find yourself feeling more irritable or easily frustrated than usual, especially when you are hungry or after meals, this could be a sign of prediabetes. It's important to be aware of these mood changes and discuss them with your doctor. Keeping a diary of your symptoms, along with information about your diet and blood sugar levels, can help identify potential patterns and aid in the diagnosis and treatment of prediabetes. Additionally, adopting stress management strategies such as meditation, regular exercise, and relaxation techniques can help control irritability and improve overall well-being. Sign number 4. Frequent infections. Frequent infections can be a silent sign of prediabetes that many people may not associate with the condition. When blood sugar levels are persistently elevated, this can impair the immune system's ability to fight infections effectively. As a result, people with prediabetes may be more prone to developing recurrent infections, such as urinary tract infections, fungal infections on the skin and nails, and gum infections. If you notice an increase in the frequency or severity of infections, especially in areas like the mouth, skin, and genital tract, it's important to inform your doctor. These persistent infections may be a warning sign of prediabetes or other related conditions. Your doctor may recommend additional tests to assess your blood sugar levels and discuss appropriate treatment strategies. Maintaining good hygiene, taking care of oral health, and following a healthy lifestyle can also help strengthen the immune system and reduce the risk of recurrent infections. Sign number 5. High blood pressure. High blood pressure is a common risk factor for heart disease and strokes, and it can also be a silent sign of prediabetes. When blood sugar levels are persistently elevated, this can damage the lining of blood vessels, making them more susceptible to plaque buildup and narrowing. As a result, the heart has to work harder to pump blood through these damaged blood vessels, leading to high blood pressure. If you have consistently high blood pressure readings, even without other obvious symptoms of prediabetes, it's important to discuss this with your doctor. They may recommend additional tests to assess your blood sugar levels and determine if prediabetes may be an underlying cause. Controlling blood pressure through lifestyle changes, such as reducing sodium intake, regular exercise, and stress management, as well as medications if needed, can help protect your cardiovascular health and reduce the risk of complications associated with prediabetes. Sign number 6. Fatigue. Fatigue is a common symptom that many people experience, but when persistent and unexplained, it can be a silent sign of prediabetes. When blood sugar levels are elevated, the body's cells may have difficulty using glucose efficiently to produce energy. As a result, you may feel tired, lethargic, and low on energy, even after a good night's sleep. If you notice that you are constantly feeling fatigued, despite getting enough rest and maintaining a healthy lifestyle, it's important to mention this to your doctor. They may request tests to check your blood sugar levels and assess whether prediabetes may be an underlying cause. Additionally, making lifestyle changes, such as adopting a balanced diet, exercising regularly, and managing stress, can help improve energy levels and combat fatigue associated with prediabetes. Sign number 7. Lack of concentration. Lack of concentration and difficulty staying focused can be silent signs of prediabetes. When blood sugar levels are elevated, this can affect the brain's ability to function optimally. Glucose is the brain's primary source of energy, and fluctuations in blood sugar levels can lead to problems with concentration, memory, and mental clarity. If you notice that you are having difficulty concentrating on daily tasks, forgetting important information, or feeling mentally confused, it's important to discuss these symptoms with your doctor. They may recommend tests to assess your blood sugar levels and determine if prediabetes could be contributing to these cognitive problems. In addition to controlling blood sugar levels, adopting healthy habits such as a nutrient-rich diet, regular exercise, and stress management techniques can also help improve brain function and concentration. Sign number 8. Excess abdominal fat. Excess abdominal fat, especially around the waist, is a silent sign of prediabetes that should not be ignored. Visceral fat, which accumulates deep in the abdomen, is strongly associated with insulin resistance, a condition in which the body's cells become less sensitive to the action of insulin. This can lead to elevated blood sugar levels and increase the risk of developing prediabetes and eventually type 2 diabetes. If you notice an increase in waist circumference or have difficulty losing abdominal fat, even with diet and exercise, it's important to talk to your doctor. They can assess your blood sugar levels and other risk factors, as well as provide guidance on lifestyle changes to help reduce abdominal fat and improve insulin sensitivity. Adopting a balanced diet, engaging in regular exercise, and managing stress are effective strategies to combat excess abdominal fat and reduce the risk of prediabetes. Sign number 9. Dry mouth and excessive thirst. Dry mouth and excessive thirst are silent signs of prediabetes that many people may not immediately associate with the condition. When blood sugar levels are elevated, the body tries to eliminate the excess glucose through urine. This can lead to increased urination and consequently dehydration. As a result, you may feel a constant thirst and have a dry mouth, even when drinking fluids regularly. If you notice that you are always thirsty and that your mouth is always dry despite drinking enough water, it's important to mention these symptoms to your doctor. They may request tests to check your blood sugar levels and assess whether prediabetes could be the underlying cause. In addition to controlling blood sugar levels, drinking enough water throughout the day, avoiding sugary drinks and excessive caffeine, and maintaining good oral hygiene can help relieve dry mouth and excessive thirst associated with prediabetes. Sign number 10. Tingling and numbness in extremities. Tingling and numbness in the hands and feet can indicate prediabetes, a condition in which persistently elevated blood sugar levels damage nerves over time, causing diabetic neuropathy. The affected nerves send improper signals or stop sending them, resulting in strange sensations. If you notice these symptoms, inform your doctor to assess your blood sugar levels. Controlling blood sugar through lifestyle changes and medications can prevent or slow the progression of neuropathy. Taking good care of your feet by keeping them clean, dry, and wearing appropriate footwear also helps protect them and avoid complications associated with prediabetes. Sign number 11. Slow healing. Slow healing of cuts, scrapes, and wounds is a silent sign of prediabetes that should not be ignored. When blood sugar levels are persistently elevated, this can affect the body's ability to heal wounds efficiently. Excess glucose can damage small blood vessels and nerves, impairing blood flow and the delivery of nutrients and oxygen needed for proper healing. If you notice that cuts and wounds are taking longer than usual to heal, or if you have wounds that show no signs of improvement, it's important to inform your doctor. They may request tests to assess your blood sugar levels and determine if prediabetes could be contributing to the slow healing. Controlling blood sugar levels through a healthy diet, regular exercise, and medications if needed can help improve wound healing. Additionally, taking good care of any cuts or wounds by keeping them clean and protected and seeking medical attention for wounds that do not heal are also important measures to prevent complications associated with prediabetes. Sign number 12. Dry, itchy skin. Dry, itchy skin can be a silent sign of prediabetes that many people may not immediately recognize. Elevated blood sugar levels cause the body to lose more fluids through urination, leading to dehydration and dry, flaky, itchy skin. Additionally, prediabetes can affect blood circulation and damage small blood vessels in the skin, contributing to dryness and itching. If your skin is constantly dry and itchy, despite regular use of moisturizers, it's important to mention these symptoms to your doctor, who may recommend tests to check your blood sugar levels. Controlling these levels through a healthy diet, exercise, medications, drinking enough water, using gentle moisturizers, and avoiding hot and prolonged baths can help relieve these skin symptoms associated with prediabetes. Sign number 13. High cholesterol. Unexplained weight loss can be a silent sign of prediabetes, although the condition is often associated with being overweight. When blood sugar levels are very high, the body may start breaking down fat and muscle for energy due to insulin resistance, leading to unintentional weight loss, even without significant changes in diet or physical activity. If there is unexplained weight loss, especially with other symptoms of prediabetes, such as excessive thirst or frequent urination, it is crucial to inform your doctor, who may recommend tests to assess blood sugar levels. Controlling these levels through a healthy diet, exercise, and medications can help stabilize weight and prevent complications associated with prediabetes and diabetes. Sign number 14. Frequent cramps. Frequent cramps, especially in the legs and feet, can be a silent sign of prediabetes. When blood sugar levels are persistently elevated, this can damage nerves and blood vessels over time. Nerve damage can lead to involuntary and painful muscle contractions known as cramps. Additionally, impaired blood circulation due to damage to blood vessels can contribute to the occurrence of cramps. If you are experiencing frequent cramps, especially at night or after physical activity, it is important to inform your doctor. They may recommend tests to assess your blood sugar levels and determine if prediabetes could be contributing to the cramps. Controlling blood sugar levels through a healthy diet, regular exercise, and medications if needed can help reduce the frequency and severity of cramps. Additionally, regularly stretching muscles, staying hydrated, and wearing proper footwear can also help relieve cramps associated with prediabetes. Sign number 15. Erectile dysfunction. Erectile dysfunction can be a silent sign of prediabetes in men of all ages. Persistently elevated blood sugar levels can damage nerves and blood vessels, including those responsible for erectile function. Insulin resistance in prediabetes can also affect the production of nitric oxide, which is essential for relaxing blood vessels and achieving an erection. If there are recurring difficulties obtaining or maintaining an erection, it's important to discuss this with your doctor, who may recommend tests to assess blood sugar levels. Controlling these levels through a healthy diet, exercise, medications, and addressing other risk factors such as obesity, smoking, and a sedentary lifestyle can improve erectile function and promote sexual health and overall well-being. Sign number 16. Excessive urination. Excessive urination, also known as polyuria, is a silent sign of prediabetes that many people may not immediately associate with the condition. When blood sugar levels are elevated, the body tries to eliminate the excess glucose through urine. This can lead to increased frequency and volume of urine production. If you notice that you are urinating more frequently than usual, especially at night, nocturia, and producing large volumes of urine, it is important to mention these symptoms to your doctor. They may request tests to check your blood sugar levels and assess whether prediabetes could be the underlying cause. Controlling blood sugar levels through a healthy diet, regular exercise, and medications if needed can help reduce excessive urination. Additionally, limiting fluid intake before bed and avoiding diuretic beverages like coffee and alcohol can also help alleviate nocturia associated with prediabetes. Sign number 17. Unexplained weight loss. Unexplained weight loss is a silent sign of prediabetes that may seem counterintuitive, since the condition is often associated with being overweight. However, when blood sugar levels are very high, the body may start breaking down fat and muscle for energy, as it cannot use glucose efficiently due to insulin resistance. This can lead to unintentional weight loss despite no significant changes in diet or physical activity. If you are experiencing unexplained weight loss, especially if accompanied by other symptoms of prediabetes, such as excessive thirst or frequent urination, it is crucial to inform your doctor. They may recommend tests to assess your blood sugar levels and determine if prediabetes or even type 2 diabetes could be causing the weight loss. Controlling blood sugar levels through a healthy diet, regular exercise, and medications if needed can help stabilize weight and prevent complications associated with prediabetes and diabetes. 10 tips to reverse prediabetes. Reversing prediabetes is possible with lifestyle changes that help control blood sugar levels and improve insulin sensitivity. Here are 10 effective tips to help reverse prediabetes. 1. Eat. A balanced diet. A balanced diet is essential for diabetes management. Opt for a diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Avoid processed foods high in sugars and saturated fats. Plan your meals and have healthy snacks to keep blood sugar levels stable throughout the day. Control portion sizes and chew your food well. Include fiber in your diet, as it helps slow down the absorption of sugar in the blood. Consult a nutritionist to develop a personalized eating plan that meets your specific needs. 2. Monitor carbohydrate intake. Carbohydrates have a direct impact on blood sugar levels. Therefore, it's crucial to monitor your intake of this nutrient. Opt for complex carbohydrates, such as whole grains, legumes, and fruits, instead of refined carbohydrates, such as white bread and sweets. Learn to count carbohydrates and control portion sizes. Distribute carbohydrate intake throughout the day to avoid blood sugar spikes. Pay attention to food labels and choose options with a low glycemic index. Work with a nutritionist to determine the ideal amount of carbohydrates for each meal and snack. 3. Exercise regularly. Regular physical activity is key to diabetes management. Exercise helps improve insulin sensitivity, making it easier to control blood sugar levels. Additionally, physical activity helps maintain a healthy weight and reduces the risk of diabetes-related complications. Aim for at least 150 minutes of moderate physical activity per week, such as brisk walking, swimming, or cycling. Find activities you enjoy and incorporate them into your daily routine. Before starting an exercise program, consult your doctor for personalized advice. 4. Maintain a healthy weight. Maintaining a healthy weight is crucial for diabetes management. Excess weight is associated with insulin resistance, which makes it difficult to control blood sugar levels. Adopt a balanced diet and exercise regularly to achieve and maintain an appropriate weight. Set realistic goals and make gradual lifestyle changes. Avoid fad diets and opt for a sustainable long-term approach. Seek support from healthcare professionals, such as nutritionists and fitness trainers, to develop a personalized weight management plan. 5. Manage stress. Stress can negatively affect diabetes management, as stress hormones can raise blood sugar levels. Find healthy ways to cope with stress, such as relaxation techniques, meditation, yoga, or activities you enjoy. Take time for hobbies and pastimes that help you relax and disconnect from daily worries. Share your concerns with family, friends, or mental health professionals. Learn to recognize signs of stress and adopt effective coping strategies. Remember that taking care of your emotional well-being is just as important as taking care of your physical health. 6. Get good sleep. Quality sleep is essential for diabetes management. Lack of sleep or irregular sleep can affect blood sugar levels and insulin sensitivity. Try to establish a consistent sleep routine by going to bed and waking up at the same time every day. Create a comfortable sleep environment with a pleasant temperature, low light, and no electronic distractions. Avoid caffeine, heavy meals, and intense exercise close to bedtime. Aim for 7, 9 hours of sleep per night. If you have trouble sleeping, talk to your doctor about possible solutions. 7. Drink water and avoid sugary beverages. Stay hydrated by drinking water throughout the day. Water helps control blood sugar levels and eliminate excess glucose through urine. Avoid sugary drinks, such as sodas, juice boxes, and energy drinks, as they can cause sudden spikes in blood sugar levels. Opt for sugar-free alternatives, such as fruit-infused water, unsweetened teas, or sparkling water. If you consume alcoholic beverages, do so in moderation and always with food to avoid hypoglycemia. 8. Avoid smoking and excessive alcohol consumption. Smoking and excessive alcohol consumption can worsen diabetes complications. Smoking damages blood vessels, increasing the risk of cardiovascular diseases, kidney problems, and nerve damage. If you smoke, seek help to quit. There are smoking cessation programs and nicotine replacement therapies that can assist in this process. As for alcohol, excessive consumption can cause hypoglycemia and affect blood sugar control. If you choose to drink, do so in moderation and always with food. 9. Regularly monitor blood sugar levels. Regularly monitoring blood sugar levels is an essential part of diabetes management. Use a glucometer to check your glucose levels as recommended by your doctor. Keep a record of the results and look for patterns or trends. Share this information with your healthcare team so they can adjust your treatment plan if needed. Learn to recognize the symptoms of hyperglycemia, high sugar, and hypoglycemia, low sugar, and know how to act in these situations. Self-monitoring allows you to make informed decisions about your diet, exercise, and medication. 10. Consult a health professional. Work closely with your healthcare team to effectively manage diabetes. Schedule regular appointments with your doctor to assess your progress and make adjustments to your treatment plan if necessary. Follow recommendations regarding medications, insulin, and blood sugar monitoring. Consult a nutritionist to develop a personalized eating plan and a fitness trainer to create an exercise program suited to your needs. Don't hesitate to seek emotional support from a psychologist or therapist if you are facing challenges related to diabetes. Remember that you are not alone on this journey, and a team of professionals is available to help you manage diabetes and live a healthy life. Don't forget to subscribe to the channel. I wish you great health, wealth, and happiness. See you in the next video.